Hello, how are you today?
I'm doing good.
Yeah, my name is Victor Obi. I'm a student pharmacist from the University of Charleston School of Pharmacy. And today we're going to be talking about your itching, which we actually call hemorrhoid because it's signs of hemorrhoid. So, do you permit us to have this conversation today?
Yes, sir.
Okay, can you confirm your name, please?
Robert,
Oh, Robert. Can you confirm your date of birth for me?
April 7, 75.
Oh, that's nice. Um, what are the symptoms like?
I get a lot of itching on my anus.
Oh, what other symptoms do you have?
Just itching, a lot of itching around my
A lot
anus.
of itching. Oh, what are these symptoms like?
I, it just feels like it's itching, and so then I feel like I need a scratch.
Oh, how have the symptoms changed?
Nothing's really changed. It still itches and makes me want to scratch a lot.
Uh, what has been done so far?
Nothing.
Has this happened in the past?
No.
When did this start?
It's been about, I think, 2 days ago that
Two
when it came up.
days. Where are the symptoms located?
It's just all around my anus.
Around your anus?
Yes. You want to
Um,
see?
No, it's okay.
Okay.
Are you having symptoms anywhere else in your body apart from your anus?
No, just there on my anus.
What makes it worse?
Um, just when I scratch it, it I guess kind of inflames it or something, and makes me want to scratch it some more.
Oh, what makes it better?
Nothing.
Okay, are you on any medication right now, both prescription or non-prescription medication?
No, not right now.
Uh, do you have any allergies?
No, no allergies.
No allergies.
Like talking about like grass,
Yeah, like when you
hay
take,
fever.
yeah, like any form of allergies.
No,
Uh, okay, so do you actually take alcohol, tobacco, or any illicit substance? Do you use any of these?
no.
So, Mr. Robert, based on the information you've provided to me, you are eligible for self-care.
Okay.
So today I'm going to be recommending a medication called hydrocortisone. Hydrocortisone is actually the generic version. So what I'm giving you today is preparation H hydrocortisone, which is a brand form of hydrocortisone. So this preparation H hydrocortisone is used to treat signs of anus itching and skin rashes. Okay, this medication's maximum strength is 1%, but the one I'm giving you today is 25 to 30 milligram. It is in suppository formulation, and basically it should be taken through insertion through your anus
Okay.
twice daily for 2 weeks.
Not by mouth.
Not by mouth.
Okay.
Okay, what you have to do is simply remove the foil from the rectal suppository, which I'll be giving to you, and insert one suppository, pointing the end first. Okay, and then you avoid unwrapping the suppository for too long, because the suppository is soft, so you have to chill it in a refrigerator and run cold water over it. This is how you're gonna take it. So this medication has some adverse effects, and the common adverse effects of this medication are signs of allergic reaction, like rash, hives, itching, red swollen blisters, and fever. These are some adverse effects, but the rare ones that this medication can cause, but not the rare but serious side effect it can cause, is burning, pain, and rectal irrigation, like your anus irrigation. So the warning and precaution for this medication is that you should not use this medication when you have like anal obstruction. Then when you see signs of abscess and bleeding, you should not use this medication.
Okay.
So this medication also have like drug to drug interaction. So do not use this medication if you are taking any antidepressant. You know what antidepressant? Maybe if you are taking any depression medication, you have high blood pressure, you're taking some high blood pressure medication, you should not use this medication with it, And then this medication can actually cause like severe headache, blood vision, buzzing in your ears. It can cause anxiety, confusion, chest pain, shortness of breath, and even uneven heartbeat and seizure if you take it with blood pressure medication. So do not take it with blood pressure medication. So how can you avoid all these potential side effects of this medication? You know very well that all drugs have side effects, but however, many people have no side effects or only have minor side effects. But when you have any of these hazard risks, you just have to call your doctor or get medical help if you notice any sign of anus bleeding, like we've said in the past. If you notice any sign of severe irrigation around your anus, or you're noticing like dangerously high blood pressure while taking this medication, you should just simply call 911 or contact your doctor immediately. Okay, should you miss any of your dose? I know things happen and you can mix your dose. So when you miss any of your dose, you have to take a missed dose as soon as you think about it. If it is not close to the time of your next dose, skip the missed dose and get back to your normal time of taking the medication. Do not use 2 doses at a time. This can be very dangerous, Mr. Robert. Then how do you store this medication? You should store this medication by protecting it from heat. You don't have to keep it in a place that is very hot. You should store it at room temperature. Do not freeze it at all. Freezing is not good for this medication. Then you have to make sure you keep this medication safe, maybe in a locked box, because you have to make sure you keep it out of reach of children, because if children take this medication, it can cause a whole lot of adverse effects.
Oh, I don't have kids. I have a dog.
Oh, you have a dog. Okay, so you have to keep it out of reach of your pet. So that's why you need to keep it in a secure environment.
Okay.
So we have like some techniques for self-monitoring. So to monitor your medication, you have to always do pill count. You know what is pill count?
No.
Like when you bring out your medication, you know how many you've taken and how many that is remaining.
Oh, okay.
So you have to do pill count. This is a way to self-monitor your medication. Then you have to as well use like electronic device, like maybe an alarm clock or anything to remind you of the time that you are supposed to take this medication. Or maybe you can actually write down this medication on your diary. Maybe if you use a phone diary, you can put it down on your diary and make sure you set an alarm for it, so that once it's time for you to take this medication, you can just come up and just take it and it will remind you. So another way that you can help improve yourself from this anal itching, which we call non-pharmacological treatment, is that you should avoid sitting long in the toilet. Now, when you pass in a bowel movement, you should avoid sitting long in it. And then you should not scratch the affected area, because when you scratch it, it might cause bleeding, which you don't want it.
Yeah.
Then should you have any confusion about this medication, please do not hesitate to come back to the pharmacy. So for the sake of understanding, can you repeat any of the things I told you?
That's a lot of information.
Okay, I'll be giving you a copy of everything we've said today. So should you have to go back to it to remember how you're going to be taking the medication and the directions of taking this medication, it can be able to like remind you. So do you have any question for me today?
No, sir.
Okay. Anyway, Mr. Robert, thank you so much for coming. Like I told you, should you have any confusion, just breathe in. Thank you.